Dr. Ahmed Abdurrahman, as usual, and today we'll be talking about diabetes. Please do not forget to subscribe, like, and share this video for the benefit of the public. So, today we are going to be talking about diabetes. We'll be defining of what diabetes is. We're talking about the types of diabetes we have, and we will also talk about the signs and symptoms of diabetes. And we will conclude this topic by talking about the risk factors. Diabetes is a broad topic, so we may not be able to finish it today. So we will just consider talking about the definition of diabetes, the types of diabetes, and we'll talk about the signs and symptoms of diabetes, and we'll talk about the risk factors. And in our next episode, we'll talk about the complications. So let's start with diabetes. What is diabetes? So now when we talk about diabetes, diabetes simply means an elevated blood glucose level over a long period of time. So simply put, when the sugar in your blood is increased over the normal levels for a long period of time, then you say you are having what we call diabetes. What are the types of diabetes? There are two major types of diabetes. We have diabetes mellitus and diabetes insipidus. Today, we are not going to go too deep into the types of diabetes, but we are going to be focusing much on the diabetes mellitus, as this is what affects a lot of people. So let's start with diabetes mellitus. So with diabetes mellitus, it's very common amongst elderly people, and then even some adolescents. Why am I saying this? I say this because most adolescents are asymptomatic. They may not show the symptoms, but for the elderly, mostly they will come with symptoms of diabetes, and it's easy to pick up in the elderly people. What are the signs and symptoms of diabetes? So, with diabetes, you can have urinating too much, which in English, in medical terms, we call polyuria. You also have excessive thirst for water. Okay, you always feel like drinking water, which we call polydipsia. Okay, the other thing you can have with regard to diabetes is that you easily get infections. Okay, so for every small number of days, you come down with infections. Okay, this is another sign of diabetes. Another thing is you can be having numbness in your legs. Okay, and this is mostly when the disease has advanced. Okay, when the diabetes has been there for a very long time, you begin to have numbness in your legs. Okay, these are some of the symptoms that you can easily pick up in a diabetic patient. Now let's go ahead and talk about the risk factors that are associated with diabetes. With diabetes, the number one risk factor is having a first degree relative who is diabetic. So when you have a first degree relative who is diabetic, you stand a higher chance of getting diabetes. With first degree relative, what it means is that you have somebody in your family who shares the same mother or the same father with you who is diagnosed with diabetes. Or better put, in one of your parents or both of them are diabetic. So you have a first degree relative who is diabetic. This is the number one risk factor of diabetes. Let's come to the other risk factors. Now, these risk factors are called the modifiable risk factors. They are modifiable because you can do something about it. Okay, the first one I mentioned, if you have a family member who is a first degree relative and the person has diabetes, for that one is genetic. You cannot do much about it. But the rest I'm going to mention are modifiable risk factors. Okay, and prominent amongst them is sedentary lifestyle. So when you eat a lot of calories, okay, and you are not somebody who is active, you are accumulating a lot of glucose in your body, okay, and you are not using it. So as you keep doing this for a long period of time, your body tends not to use the glucose well, and the glucose in your blood tends to destroy your blood vessels and sooner or later affects your nerves. Okay. Now, with sedentary lifestyle, okay, another way to explain it is when you accumulate a lot of calories and you are not active, you become obese. Okay, and by being obese, you become so fat. Okay, because you are accumulating without using, you gather a lot of fat. Okay, you become so increase in size, and this is what we commonly call obesity. Okay, this will increase your risk of being diabetic. Okay, so you should always try to be active, even if your work involves sitting in the office. Always try to be active. Okay, exercise 3 times in a week. That will help burn down some calories and reduce your risk of having diabetes. Okay, another thing that can predispose you to having diabetes is taking certain medications. Okay, is taking certain medications. This is not so common, but it happens. It does happens. When you take certain medications, it predisposes you to getting diabetes. Another risk factor is somebody who has uh, pancreatic disease. Okay, for one or two reasons, the person has a pancreatic disease. Now, the pancreas is responsible for secreting a certain enzyme which breaks down the glucose. Okay, that's what we call the insulin. Now, if your pancreas is diseased, it's not able to produce this enzyme in sufficient quantities, and that will predispose you to getting diabetes. Now, as I said earlier on, I don't want to prolong this video. Let's make use of this information. Please subscribe and share. Who knows, it will benefit a lot of people. Diabetes is a serious disease, and we need to see it as such. Okay. Okay, so in our next episode, we will talk about the complications of diabetes. Okay, we'll talk about how diabetes causes heart disease, how diabetes affects your kidneys, how diabetes can lead you to getting stroke and other conditions. Okay.